a ride to save lives. A motorcycle ambulance navigates through the bush and narrow dirt roads in Toroki district in western Uganda to reach one of the isolated villages that dot the grazing fields. Aboard what has come to be known here as the village ambulance is a community health worker who received a call about a pregnant mother who has gone into early labor. As community health workers, we had a difficult time getting the pregnant mothers to hospital. We would carry them on the back or on homemade stretchers. Many never made it to hospital. They died on the way there. The village ambulances were introduced here in western Uganda in June this year. Their main aim to ensure pregnant mothers, especially those at risk, access fast and reliable transportation to a health facility.
You'll find some areas a mother has to travel between 30 and 40 kilometers to reach the health center where they have to deliver. So out of the 75% antenatal care 1 visits that you receive, you'll find that only 15% come back to the health centers to deliver. So that means there's so many out there that remain in the villages, and you can't tell how many used to die before the ambulances were established.
Unlike the vehicles, the motorcycle ambulances are easier and cheaper to maintain. Since the introduction of the village ambulances 3 months ago, at least 100 women in this area have used them. This, a story of resilience and innovation to save lives. Innovative solutions that will go a long way in helping Africa attain sustainable development goals.
Getting the resources out to the countryside, getting midwives, primary health care workers out to the countryside where the poorest people live, or in the cities and the slums where the poorest people live, that they have access to primary health care, they have access to vaccinations, because that's what really saves kids' lives.
And getting them to accept and own those solutions. Sarah Kimani, SABC News, Western Uganda.